All right, good morning, everyone. Today we start the new cycle of maybe it's the fifth one of our webinars on bioethics. And I'm very happy to host today at California State University Bay, Professor Jon Weidenbaum. He comes from Berkeley College in New York, and today is going to introduce us to an overview of what is bioethics and its main concepts. So thank you so much, Jon, for being here today. The floor is all yours.
It's my pleasure. Thank you for inviting me. Good morning out in California. Good afternoon from New York. I'm going to begin with a scenario. From 2005, this is the well-known case of Terri Schiavo. In 1990, a young woman named Terri Schiavo suffered a heart attack and a stroke, likely due to caffeine addiction and an eating disorder. Her upper brain hemisphere was terribly damaged, the extent to which was confirmed after the autopsy. And most doctors claim that Terri was in a permanent vegetative state. However, Terri's lower brainstem was perfectly intact. Thus, she was breathing on her own without the help of a respirator machine. All Terri needed was a feeding tube to keep her nourished. She made all kinds of movements and noises while on her hospital bed, even though most doctors claim these were automatic, without awareness or intention of any sort. Terri's parents, people of deep Christian faith, saw their daughter as alive and were steadfast against pulling out the feeding tube. Terri's husband, Michael, on the other hand, believed that it was Terri's wishes to have the feeding tube removed so Terri's body can expire. Terri's parents and husband fought the issue in court for 15 years. In 2005, the court ruled in Michael Schiavo's favor, and Terri's feeding tube was removed. She starved to death 13 days later. A general question to ask, was pulling out the feeding tube the correct thing to do, or was it murder? But it may be more useful to ask several other questions in regard to this case. Here is one. Between 1990, after her brain was damaged, and 2005, was Terri Schiavo alive or dead? While euthanasia and physician-assisted suicide, which I will define a little later, are the main among the topics of our discussion, the case of Terri Schiavo overlaps with another issue in bioethics: definitions of death. Defining death was once very simple: breathing stopped, rigor mortis set in, etc. But in time of respirator machines, feeding tubes, organ transplants, and other medical technologies, things have become radically more complicated. For instance, if a person is warm to the touch, their heart's still beating, but they have no sense of self, no memories or thoughts, are they alive or dead? Well, whole brain-centered definitions of death would say yes. As long as vital parts of the brain are working, those which regulate breathing, heartbeat, etc., then the individual is deemed to be alive. Higher brain-centered definitions of death would say no. The minute consciousness is gone, including thought, emotion, self-awareness, then the individual is deemed to be deceased. Which of these definitions of death do you hold to be the correct one? How many students have walked into my class over the years and at least had some sense that they knew the difference between life and death? And of course, leaving my class on the day we discuss this, they discover, it's not so black and white any longer. Well, what we even mean by death, okay? What exactly is bioethics? Definitions of death is one of my favorite topics in bioethics. Bioethics, or biomedical ethics, in the broadest sense, is the study of the ethical issues which arise in medicine. I have always argued that bioethics is one of the most important branches of applied ethics. So if ethics, as one of the great subdivisions of philosophy, is the study of right and wrong, as well as the good life for human beings, bioethics is a subdivision of applied ethics, which is the application of ethics and ethical theories toward controversies in our practical lives, like ethics of war or just war theory, or ethics of incarceration or crime and punishment, or environmental ethics and animal rights. Why do I state that bioethics is among the most important areas of applied ethics? There is a poll I always present to my students. Who here, I asked the class, was born in a hospital? Most students raised their hands. I then tell the class that most of them will die in a hospital. And those that don't die in a hospital will at least be pronounced dead by a doctor. Add to this all of the major life events, from giving birth to a child, to having a risky operation, to seeing a therapist. Our entire lives are framed in a medical context. Thus, the ethics of medicine pertain to all of us. I have just introduced you to one of my favorite topics in bioethics, definitions of death. Other topics which fall under bioethics include abortion, physician-assisted suicide, euthanasia, human and animal experimentation, morally tainted sources, in vitro fertilization, genetic engineering, stem cell research, cloning, healthcare ethics, healthcare distribution. There are subtle distinctions between terms that are often used interchangeably with bioethics or biomedical ethics. It is worthwhile to mention this, even though, with the exception of medical humanities, I don't always honor these subtle distinctions. And I will use some of these terms interchangeably with bioethics. But it's good to go over them anyway, just to give people a sense of sort of how subtle some of the terms can get. Medical ethics is the ethical issues involved in the practice of medicine, like the relationship of doctors to patients. Healthcare ethics is the subdivision of medical ethics which extends beyond the role of doctors and to all healthcare practitioners, including nurses, pharmacists, etc. Seen in this light, bioethics or biomedical ethics includes the practice of medicine, but also includes the new biotechnologies and medical experimentation. Note, I already mentioned that I don't always honor these subtle distinctions myself, since, among other things, I think all topics kind of connect. How can you really separate the issue of biotechnologies from the practice of medicine? And because not all course texts honor these distinctions. For instance, a book I use in one of my courses is called Healthcare Ethics, or at least has that in its title, and yet it touches upon all the areas I have mentioned: technology, human experimentation, and the practice of medicine alike. I do see the medical humanities as distinct, or more accurately, as even broader than bioethics and including bioethics, but covering even more. Medical humanities is the study of the relevance of the humanities: philosophy, anthropology, religious studies, art, literature, for understanding medicine. This discipline often takes a more holistic approach to the human being in a medical context, seeing us as more than simply medical pathology, and seeing us in the context of art, literature, etc. Now, when we do healthcare ethics or bioethics, we talk about 4 principles. There are 4 reigning principles hanging over our discussions in bioethics. One of them is non-maleficence. This is the principle of doing no harm. Do not harm the patient. Then there is beneficence, to actively work for the good of the patient, and which is not identical to non-maleficence. If I were a parent, for instance, I should not harm my children, but is it enough to simply not hurt my children to be a good father? No, of course not. I should work for my child's active benefit. I should help them learn a new language, take them to softball practice or whatever I need to do, So beneficence is to actively work for the good of the patient, not simply not harming them. Autonomy, to respect the free decisions and wishes of the patient. And finally, justice, to promote equity in the practice of medicine, including the fair distribution of medical technologies and services, combating racism and sexism in medicine, etc. So these are the 4 principles of healthcare ethics: non-maleficence, beneficence, autonomy, and justice. And it needs to be stated, a good part of the true and lasting controversies in bioethics comes from the occasional clash between these principles, which may arise in some contexts. For example, my uncle claims to be the Messiah and to be appointed as such by wise extraterrestrial beings. I'm making this up, by the way. He wears a cap made of discarded cloth and spends his days wandering around the neighborhood, splashing paint on a canvas in the attic of his sister's home. When he is medicated, he's kind of unhappy, but his claims to be the Messiah disappear, as does his peculiar hat, and he can even hold down a job. How would the four principles of bioethics pertain to his case? Certainly, one can make the case that the principle of beneficence would have us medicate him, but at the expense of overriding his autonomy, removing his decisions for himself, claiming that he can no longer be said to be autonomous because he has a severe mental illness. And of course, what are the parameters of what we call a mental illness? When can a person be so, what kinds of behaviors and thought patterns, deem one to be mentally ill, and therefore it's okay therefore to remove their autonomy. Okay. So a situation where justice may be difficult to apply would be the controversy over organ donations, organ transplants. Ideally, those who need a new liver or kidney should receive them. And yet there are not enough livers or kidneys to go around. Upon what principles may we arrange a triage? A triage is a system of prioritizing when the numbers of those in need exceed the available resources. What should go to the top of the list? Who should go to the top of the list? I'm sorry. Simply first come, first serve? How about those who can most afford a new organ? How about the age of the potential recipient? Even here, should we prioritize those in the prime of their lives or the very young with their entire lives ahead of them? You can see any decision you make is going to speak of some kind of discrimination. Should we cross off recovering alcoholics from the list for those who need new livers, for instance? Okay, so there's all kinds of controversies that are in gray areas, even when we apply the four principles of healthcare ethics. And now, there are many theories in ethics. Four moral theories are the most commonly cited when struggling with the various scenarios and controversies in medicine. Utilitarianism, created by Jeremy Bentham, advanced a little further by John Stuart Mill, speaks about the greatest amount of happiness for the greatest number of people, okay? Even if it permits a little bit of injustice along the way. Kantian ethics, created by Immanuel Kant, great German Enlightenment philosopher. This is a deontological moral theory, that is to say, a moral theory which stresses not the consequences of our actions, but the category under which the action falls, the type of action that it is. And Kantian ethics has us obey our moral duty, regardless of the context or situation. And our duty includes actions we can universalize, those rules, those actions that we can rule to become we can wish to become a universal law, that we would have everyone do if they were in the same situation, and which treat human beings as possessing inherent worth as opposed to instrumental worth. That is to say, to not use another human being. Virtue ethics, it's created by Aristotle, ancient Greek philosopher, emphasizes not a rule for action, but the cultivation of our moral character. That is to say, those actions which reflect the virtues, patience, kindness, strength, etc. And then there is what's called natural law theory, has its roots in, of course, Aristotle, but Aquinas in the 13th century is the one who offers one of its most recognizable forms. There are purposes built into nature and human nature, and ethics is about the realization of these purposes. For Aquinas, this includes the preservation of life, the birthing and educating of children, etc. A key component of natural law theory, relevant for bioethics, is what's called the principle of double effect. This is the idea that it is okay to intend the good, even if it leads to foreseeable bad consequences. But it is never okay to intend the bad, even if it leads to good consequences. As an example, an elderly patient in a terminal condition is in terrible agony. While it is not okay to directly intend the death of this patient, it is morally acceptable to give the woman pain medicine in the interest of relieving her agony, even if we know this will end her life. And then, of course, you have the the ethics of care. Carol Gilligan is one major formulator of this, as is Nell Nodding. Okay. And this emphasizes not an abstract principle or rule for action, like the utilitarian formula or the categorical imperative, but the cultivating of a caring and nurturing relationship to other human beings. And so these are the ethical theories that most often make their way into discussions of bioethics, discussions in a medical context, okay? And of course, along the way, it is not uncommon to also address several argumentative fallacies which play a role in bioethics or medical ethics. One of these being the slippery slope, okay? That is to say, or otherwise known as a domino effect, the idea that if you permit X, it leads to all these terrible consequences. It's sometimes seen as an argumentative fallacy, but in some contexts, it's actually seen as something that is worthwhile to note. For instance, when you talk about something like euthanasia, so another argumentative fallacy that's often raised is called the naturalistic fallacy. The roots of this are in the Enlightenment Scottish philosopher David Hume, but it was labeled by G.E. Moore, 20th century philosopher. The naturalistic fallacy is the fallacy of basing how we ought to live upon what is, upon perceived facts about nature. All right. So to say, a common example people often raise to illustrate the naturalistic fallacy is to say, being a vegetarian is wrong because your intestines and teeth were evolved to eat meat, right? So therefore, that's their purpose. And for you to go against their purpose is somehow immoral. And of course, that sounds ridiculous on the face of it. So that is a common used illustration for the naturalistic fallacy. And when you debate different topics in bioethics, whether it's the new biotechnologies or euthanasia or abortion, sometimes these fallacies, let's just say sometimes it becomes useful to kind of be able to call out these fallacies in particular that show up the most. All right, anyway, so I was wondering how to present the core of this introduction to bioethics. Should I present specific scenarios in detail, like the Terry Schiavo one I just gave, and have us debate it? Or should I simply present a few of the questions involved under some of the major topics in bioethics? And then maybe I'll either allow students to tell me which of these most ignites their interest, or I will choose a scenario to talk about and debate. So I decided to go the latter route. So I'm going to introduce some of the major questions that fall under some of the topics of bioethics. And then I want to come to a place where either I'll let students guide me and tell me which of these topics that they want to talk about, which they're most passionate about, which ignites their interest the most, or I can come up with a scenario taken from real life. Either we can go back to Terry Schiavo, or I can come up with a new one, or I can draw upon another, okay? All right. Abortion. Is it ever moral to terminate a pregnancy? Up to what point? What do we call that which inhabits the uterus of a pregnant person? An unborn child? A fetus or a conceptus? When can we say a human being has entered the world? Birth? Early in the pregnancy? After a specific trimester? If we do not pronounce what's inside a woman's uterus to be human at conception, then when does it become human? And even if we consider a fetus a human being, is it possible that abortion is still defensible? Some say yes. A very classic article that's often introduced, if not in a bioethics course, in a regular ethics class, is Judith Jarvis Thompson's classic, I believe it's 1971 article, A Defense of Abortion, where she uses these almost psychedelic kind of thought experiment. I mean, she herself does not think a fetus is human, but she accepts it for the sake of argument and comes up with these unique thought experiments to have us look at pregnancy in a new kind of light, especially if you're pregnant and don't want to be. And she argues that even if a fetus is to be considered human, abortion is still perfectly defensible. You're not morally, it'll be awfully nice to lend out your body for 9 months, but you're not morally obligated to do so. Okay. And if you wanted, we could discuss that famous article, but I often think it's best for people to read that first. Physician-assisted suicide. It's difficult to take one's own life. Is it ever morally correct to give a patient the means to take their own life? If so, when? When someone is in great pain? When someone's in great pain with a terminal condition? Let's say a medical pathologist invents a machine which helps his clients, individuals with no quality of life, to die. Is this person a hero or an accomplice to murder? Of course, there's quite a number of us that know the name Jack Kevorkian. That's exactly who I'm citing here, and he helped many, many, many people to die with the method of a machine. Sometimes I'd read it as called the Thanatos, other times the Mercytron, but a Thanatron or whatever, a machine that he would set up his patients with it, and then they would initiate it, and then to die peacefully. He's a really interesting, the late Jack Kevorkian, really interesting character. Finally, they put him, many times they brought him to court. Each time he was able to get exonerated. Finally, they had him on 60 Minutes, and Jack Kevorkian showed a video of him actually giving someone a lethal injection, which is no longer physician-assisted suicide. Now that's active euthanasia, and that put him in prison for quite a while. He got out of prison. I believe he ran for governor, and Al Pacino played him in I believe, an HBO movie, which is definitely worth seeing. Okay. Then there's euthanasia, the good death, when a doctor more directly assists a patient to die, let's say by removing all treatment and letting nature take its course. This is called passive euthanasia. Or administering something to end the person's life, otherwise known as active euthanasia. We already saw the case of Terry Schiavo. Again, what are the conditions which make it permissible to assist a person to die? Agony, a terminal condition, the age of the person, the persistence of the wish to die, the wishes of the family, the level of sentience held by the patient, or the presence or absence of what's called an advance directive, like a living will, or that's a document where you state your wishes in case you cannot speak for yourself, or durable powers of attorney, otherwise known as a proxy, someone you appoint to speak with you in case you're not conscious, Okay. And these all alter the situation. They transform it from being what's called passive euthanasia, where the patient simply, cannot give their wishes either way, to more from a non-voluntary euthanasia, where the patient cannot volunteer it, they're in a condition where they can't talk for themselves, to voluntary euthanasia. And for some people, that makes a moral difference. For others, it does not. Some people even think the distinction between passive and active euthanasia is a false distinction, or a morally irrelevant one, okay? Others take it very seriously. There's a difference between simply letting nature take its course and shutting off the machines, or and administering something which is to stop the person's heart. Okay. Doctor-patient confidentiality. Patients see doctors when they are at their most vulnerable, and they may not always make the best decisions, or they may make decisions which they may regret, or would have regretted if they survive. Is it ever moral to withhold information from a patient for their own good? When is it moral to take a paternalistic or maternalistic role over another human being? Think of the case of involuntary institutionalization, which I got kind of introduced something like that a little bit earlier, okay? Human experimentation. The very name of this topic puts a bad taste in our mouths, and for good reason. Think of the Nazi experiments during World War II, created by the horrific Joseph Mengele in a Nazi concentration camp, which is too painful to describe. Or in our own country, the rightly infamous syphilis experiments from Tuskegee, Alabama, from 1932 to 1972. I believe that's the right year. It's often held that such abuses and experimentation would be prevented by the standard of informed consent. The patient's informed about what may happen. Consent, they give their free consent. But there are gray areas with informed consent. Prisoners, for instance, prisoners are already in a situation, prisoners are seen as ideal for experiments, and if they give their informed consent, we know what they're eating, we know how much rest they're getting, they're the perfect control group. But at the same time, they're already in a situation of distress. And maybe they want to relieve that distress, or they believe it'll shorten their jail term. Can they really give informed consent seems to assume that we're in some kind of neutral space where we can simply say yes or no. But if a person is already in a condition of distress, or how about, experiments carried out in the third world, or where people might be in a state of desperation, or let's say that they can't even quite get the modicum of education enough to even really understand, even when you try to inform them as much as possible as what can happen, if they were experimented upon. Can they give their informed consent? How about for the medicine for the mentally ill, medicine for children? We want better and better medicines for the mentally ill and for children, but how do they give their informed consent? I suppose someone gives informed consent for them. But think of the possible abuses of that, right? Imagine growing up knowing your mother handed you over for medical experiments. Animal experimentation. That's a gray area with experimentation. Is it moral to test on non-human animals for human need? So I absolutely love talking about the issue of animal rights in my basic ethics class. But of course, in the context of bioethics, it's a very, very important topic. Is it moral to no matter how much we try to treat the animals humanely, the non-human animals, I should say, by what moral right do we exploit the lives of other species for our own needs? What gives us the right to do that? Psychologist and animal rights advocate Richard Ryder came up with a term. It's duly amplified by the philosopher Peter Singer: speciesism. Speciesism is the act of discriminating based upon species. There are some animal rights advocates that believe that the future will look at us in the present and say that, they'll, or some ethicists in the present look at those of us who eat meat, those of us who wear leather, and those of us who promote animal experimentation as specious, using that, and that word will feel as much as negative and as words like racism or sexism. Okay, or is it an offensive comparison? For some people, it's an offensive comparison. For others, it's not. All right, for others, it's a real kind of discrimination, and that we take for granted that we have the right to do. But who says? Upon what grounds? Morally tainted sources. Is it okay to use scientific data obtained through immoral means? A famous book called the Perncroft Atlas is a well-known example. It's from what I've been told, and I've seen images from it, it's a wonderfully put together book of human anatomy that I don't know if it's been equaled, and it's incredibly detailed and profoundly informative. It was also that it's claimed to have been put together by Nazis, all right, by some Nazi doctors, like one that put a little SS next to his name, and a lot of the images of the bodies, it is claimed, may have come from Nazi concentration camps. To permit the use of this book, does this honor the victims of the Nazis by putting their martyrdom to use? Or does this continue their victimization? Will this encourage future scientists to obtain fame and recognition through immoral ways? Scientists could be as human as anyone else. Everyone wants their name written on the stars. If they can obtain important, groundbreaking data through immoral means, will they do so if they know that it'll pay off in the end for themselves and make themselves famous? Who knows? So this is another one of the topic: morally tainted sources. In vitro fertilization and genetic engineering. Is it moral to choose the gender of the embryos in our partner's uterus? How about eye and hair color when this is further available? Is this the commodification of our children, what's sometimes sarcastically called designer babies, or the acceptable exercise of our choice? And what do we do with spare embryos? Not uncommon the way this goes, a number of embryos are created, and then the ones we want, we select, and the others are spare embryos. What is the moral status of an embryo to begin with? Is it okay to harvest embryos for stem cells which demonstrate what's called pluripotency, or the ability at an early stage to develop into any kind of cell in the body, and thereby showing promise for treating many conditions? Let's say a frozen locker full of embryos is thawed out. Is this mass murder? Or is this no crime at all? You can see there's a whole bunch of questions I put together here. All right. Other new biotechnologies like cloning, reproductive cloning, is the attempt to make an exact genetic replica of another organism. What are the fears and prospects of reproductive cloning for human beings? In a very well-known article, Donald Cass writes of the wisdom of repugnance, a concept that has since been called the yuck factor? Should we listen to our intuitions of disgust around a new medical technology? Or is this simply another example of the naturalistic fallacy of trying to base questions of normativity and ought upon what is facts about nature? So what, you feel disgust? Does that alone tell us that something's right or wrong? You know, people may have expressed disgust and they came up with pacemakers, for instance. Does it therefore make it morally problematic? Healthcare distribution. Can universal coverage in a healthcare system, socialized medicine, for instance, ever work? Many claim that socialized medicine leads to very long waits for specialized treatments, along with a lack of innovation in medical technology. Other systems of healthcare are equally problematic. What's a good alternative to the healthcare system we currently have in the United States, the problems of which are long noted, okay? I think actually over the many years I've been teaching bioethics, one of the most, I say exciting, but not always in a positive sense, but one of the most tumultuous moments in terms of events going on in the real world was the creation of Obamacare, and all the controversies surrounding around that. And other issues of medical distribution. What of the issues of medical resources that are fewer than the number of those in need? I mentioned the example of organ donation and organ transplants. Upon what principles should we fashion our triage or system of prioritizing? Should it be age? Should it be, level of wealth, education? Should it be first come, first serve? Consider presumed consent laws, wherein in the absence of a document or a tag or something in your wallet stating otherwise, it's simply assumed that the organs of a motorcycle accident victim, for instance, can be taken for someone who needs it, an attempt to kind of increase the numbers of available organs for those that need. All right. Now, I can go on and on and on, of course, but, in my experience, people don't always enjoy simply being lectured to. So what I would like to do, I can give you a scenario to debate, but how about if those that are present were to tell me what they would like for me to talk about further, or which of these topics that they would like to explore in the time we have remaining. I would like to hear it, and then maybe we can address it. What do you say?
That's a great idea.
I can answer questions too, as someone that's been teaching this material for quite a while.
We have 20 minutes, more or less. So,
okay.
So I would be interested in either talking further about abortion or like assisted suicide.
Wonderful, gotcha. Now, what about the topic of abortion? And in this country, my lord, look, I know people that will vote for a candidate, depending on their views on this divisive topic. I believe just around a year ago, when Roe v. Wade was overturned, was a really intense a moment for this moral controversy, and I the strength of feeling of people around me when that occurred. So what about the issue of abortion most interests you?
Just the determination of when we think the fetus, is like self-aware, when it determines to be a baby, when it's actually born. If people think that, it's born, it's alive in the womb, then why are we still using traditional birth dates when it comes out of the womb? I don't know.
These are just fantastic. Listen, this is one of the things where philosophers have long known that the words we use shape our view of reality, right? So it's not uncommon you listen to a progressive radio station or left-leaning, or for lack of a better term, and you hear, they won't use the term unborn child. They'll say fetus, or they'll say conceptus. And then, of course, on the other hand, you listen to a more conservative radio station, they'll never use the term fetus or conceptus. They'll say simply an unborn child. And look at the connotations of that language. It was very interesting when a well-known British-born American journalist who was known to be an atheist with no tolerance of religion. This is a man who wrote a book called God is Not Great, how religion poisons everything. I'm talking about a guy named Christopher Hitchens, who passed away in 2011. Christopher Hitchens surprised many people when he came out and said that he came out basically seeing abortion as morally problematic, as morally wrong. And people said, well, how can you say that? You know, I mean, you reject all, and because a lot of people automatically somehow think that, you know, being pro-life or seeing abortion as morally problematic. I'm not so sure if Christopher Hitchens went so far to be pro-life. I think he saw it as a kind of a political hijacking, if you will, of the moral reality of it. But you know, they said, how can you hold that position? He said, look, on purely secular grounds, I think the notion of unborn child is not a ridiculous concept. You know, that what's inside of a woman's uterus since conception is a human being, you know, and that's why he saw abortion as morally problematic. So, but I often, out of all the topics when I teach bioethics, I enjoy playing devil's advocate the most with this one. And on a personal note, for a long time before I first taught bioethics, I took for granted that if you were not sort of knee-jerk pro-choice, then you were a barbarian or you were a religious fundamentalist of some kind. And then I'm not saying I'm pro-life, I'm not saying that, but I am saying that when I first taught bioethics for the first time in 2003, and I actually read the articles on both sides expressed by thoughtful people, I left in a state that I think is good for a student, you know, and for a thinking human being to be in, more confused than ever. You know, you see the moral ambiguity of it, you know, in the complexity of it. But I enjoy playing devil's advocate with this. Of course, when I do in my classes, a lot of the eyes of the students become daggers shooting in my direction. And it's not uncommon. I have a student who says something like this, and I understand this. That, you know, you shouldn't even have an opinion on it if you cannot yourself become pregnant. You know, if you yourself don't know what it means like to undergo that. But that's a limiting situation with every topic we talk about in ethics beyond even bioethics. You know, think of like just war theory in ethics. When is it right to go to war? What kinds of things are right in war? Imagine someone saying, don't talk about that unless you know what it means to be a soldier, you know? So in any case, it's a rich, rich, rich topic. I love debating it. At some point, we read, as I mentioned earlier, Judith Jarvis Thompson's Defense of Abortion, where she uses these really unique thought experiments to try to sort of to kind of have us look at pregnancy in a whole different light. Yeah, okay. So any more thoughts on that, or why it interests you, or, you know?
No, I just think it's an interesting topic.
Yes.
You know, I know I saw the little comment that Susie put down there about them being able to feel pain in 12 weeks, but I don't know, just in my head, just being able to feel pain, does that, you know, prove consciousness? Or I don't know, I don't want to go down that rabbit hole. I don't know.
Sure.
You know,
Absolutely, but you know, very, very typically, you know, one question I like to put to students is, if you don't consider the fetus human at the moment of conception, then when? You know, and very often it can sound almost arbitrary. You know, when this development of the brain, heartbeat, a certain organ has human-like appearances. You know, these are the typical, when it's viable, that is to say, when in principle can live on its own outside the mother's womb, you know, but that's questionable too, you know, as a moral standard. Okay, excellent. So
Emily added a question on the chat.
Yes.
So she asked, I have concerns about abortion in those who regulate the rules. Why do people with power who have a lack of knowledge in biology get to make such decisions for everyone?
That's a fantastic question. That's a fantastic question. I assume that there should be some assurance that people that do make these decisions have knowledge of biology. Although a question to ask is, you know, is biological knowledge enough? I mean, you know, you can have a lot of knowledge. What's biology going to tell you? It can tell you all the exquisite details about what goes on in the uterus over the course of development. But I'm wondering if there's anything in that alone that can tell us about the right and wrong of it, or does that fall back upon the naturalistic fallacy, you know, where questions of normativity of right and wrong are being grafted upon or taken from simply facts about the world. I mean, there's still that what Hume saw as the fact value distinction, and so I'm wondering, there might just be a leap. It might just be a situation where all the biological knowledge in the world can't alone tell you about the right or wrong of it. Right. I mean, it's just a possibility, something to think about. But certainly, it doesn't hurt to be as educated as possible about what goes on, in a human body for any of these topics. So it's a fine question. So is there another topic in bioethics, particularly the last part of my talk, when I went through, I mentioned euthanasia, physician-assisted suicide, the new biotechnologies, I mentioned doctor-patient confidentiality, is there morally tainted sources, eugenics, genetic engineering, designer babies, IVF? That's a fascinating one. Yeah, that's a great one indeed. Is there another topic here? Or I can come up with a scenario and we can kind of debate it. That's also a possibility. Susie, at some point in your, or Dr. Ferraro, at some point in your class, do you debate the topic of Dax Cowart?
No.
Okay. So this is not an easy one. When I say it's not an easy one, of course it's difficult, like all the topics we talk about in bioethics, but it's also very difficult from another angle. Here, this student mentioned, I believe, the same student who asked me about abortion also, was it euthanasia? Was that one of the topics that interests you?
It was, assisted suicide.
So, it's interesting. Over the many years I've been teaching bioethics. Oh, well, physician-assisted suicide is a little different than euthanasia, but that is a fascinating one for sure. The case of Jack Kevorkian. And also another name to put on that is Brittany Maynard. Brittany Maynard was a young woman some years ago that had a terrible brain cancer, and she requested her doctor give her some pills to take so she can die peacefully and at her own, at her own moment, so to speak. So those are examples of physician-assisted suicide. Let me give you another one from euthanasia. And this is the story of Dax Cowart, originally Donald Cowart. As a young man, and this is particularly interesting to me because I was teaching about this gentleman for, ever since I first started teaching at all in front of a classroom, both basic philosophy 101 and bioethics. And then he just passed away like a few years ago. So it was like an interesting landmark for me, someone I've been talking about for a long time. As a young man, Donald Cowart was an athlete, served in the Air Force, who held dearly the American values of personal independence and freedom of choice. One day in his mid-20s, Donald was exploring a piece of property with his father. Both were unaware that there was a gas leak in the area. When they started their vehicle, there was a massive explosion, and the two men were burned all over their bodies. A farmer came by with a shotgun, and Donald begged the farmer to shoot him. Instead, the farmer called an ambulance. Donald asked the EMT workers not to lift him into the ambulance, but they did not listen. Donald's father died in the ambulance on the way to the hospital. For the next year, Donald was treated in a burn ward. It needs to be appreciated that this was the mid-1970s. Had Donald lived in an earlier decade, he likely would have died of his burns. Had his burning occurred in the 1990s to the present, he would have been put into a medical coma for his treatments. Instead, there was enough technology to treat Donald, who changed his name to Dax, but not to adequately treat his pain. By far, the worst of these treatments was a daily immersion in a vat full of chlorinated water. Dax felt he was being skinned alive for each of these treatments. A documentary called Please Let Me Die shows the agony of his time in the burn ward. Dax repeatedly requested that the doctors stop treating him. The doctors kept refusing, stating they were doing their job, and Dax had no right to demand they stop treating him. If he wanted to die, he can go home and do it himself. Something that Dax, now blind and missing toes and fingers, clearly was in no position to do. Dax's mother, a devoutly religious woman, took the side of the doctors. Dax tried to hire a lawyer to get him released from the hospital. This failed. A psychiatrist interviewed Dax and came to the conclusion that Dax was perfectly sane and simply wanted to die, but this didn't get Dax freed either. After Dax was released from the burn ward, he went to live with his mother. He fell into a deep depression with severe insomnia for a lengthy period of time, twice attempting suicide. Eventually, Dax attended law school, married a high school sweetheart, became a successful businessman and a lawyer. He lived many decades and enjoyed his later years very much. He wrote, lectured, and fought for patient rights until he died in 2019. In his later years, when asked if he was a happy man, Dax said yes. Then when asked if he was happy the doctors did not obey his wish to let him die, Dax answered no. All of his years of success and happiness were not worth the agony of his time in the burn ward. I was a victim to the state of medical technology, he explained. Did the doctors do the right thing in keeping Dax alive against his wishes? What do you think? Your thoughts? No, says Emily. Emily, can you tell us why? Why did the doctors do the wrong thing? I mean, he did live. If the doctors listened to his advice, Dax would have died. It would have been a waste of a life. Dax had many years left to live. Don't forget, Emily, I'm kind of playing devil's advocate here, by the way. Don't forget, doctors take not all doctors any longer, but for many, many years, doctors take what's called a Hippocratic oath, where they vow, among other things, to not commit abortions and not commit acts of euthanasia, right? Increasingly, for this reason, by the way, some doctors take a softer vow of Maimonides, which doesn't seem to so explicitly command those prohibitions. Anybody? Anyone? I'm just curious, which of you think the doctors did the right thing by keeping him alive against his wishes? Because after all, he did have many years to live, and he did live happily eventually. Your thoughts? If he wanted to, he should be able to choose. Okay, but is that true for the case for everybody, Emily? Should anyone be able to request their doctor, please stop treating me? How about my 19-year-old son? I don't have a 19-year-old son, but if I did, and I had to give him an insulin, I had to help with his insulin shot every day. If he says to me, Dad, hide this on me. My girlfriend broke up with me, and the new Star Wars movies are terrible. Hide this insulin machine on me, and don't give it to me. Am I obligated to say yes? It's his choice.
I think he should go through a set procedure, like seeing a psychiatrist or someone who keeps him mentally sane.
Yeah.
And then after, if you choose to pursue with it, then you should be able to.
But notice, though, the question then becomes, what kinds of things should the psychiatrist look for? What are some, okay, so the psychiatrists come to the conclusion that Dax is sane. But remember, though, that's only a condition to make a moral choice. That's not the only, people can be sane and still make immoral choices, correct? Right, so is sanity alone the only condition that should be there in order to make euthanasia morally permissible? Or should there be other things? You know, how much agony is one thing. Of course, we know that Dax was incredible agony in the burn ward of a hospital. How about persistence of the wish to die? You know, people change their minds all the time who want to die. Maybe the doctors had every reason to think Dax would eventually change his mind. Of course, Dax went the rest of his life thinking the doctors should have listened to him. This is true, but doctors cannot anticipate that, right? Maybe it's the family that should be consulted. Dax's mother wanted him to live. She was on the side of the doctors. So if you think about it, for instance, when it comes to the questions about the right to die, whether it's physician-assisted suicide or euthanasia, think about a number of beads on an abacus, you know, sort of like beads on a string. You know, there's the question of how terminal is the illness, how chronic is the condition, how much pain is the patient in, how persistent is the person's wish to die. Of course, the case of Dax Coward's a pretty extreme case. Some of those images I can't even find that video any longer. Please let me die. Or they made another one in the 80s called Dax's Case. You know, it's very, very difficult to watch. All righty. So is there another topic some of you would like to talk about?
We have 4 minutes.
Oh, we have 4 minutes left.
Yeah, so I don't think we can broach another case or topic, but we can still chat on this case or previous one. By the way, thank you so much for this great lecture. It was extremely clear and engaging and touched upon the main areas of bioethical concerns.
Well, thank you so much for inviting me, Susie.
Of course.
All righty.
Last question of the last minute, or do we want to say goodbye? Right. So it was great for me to see all of you, but Emily, maybe we can see each other again in other ways. But it was, yeah, fun to engage together on this bioethics class today. And thanks again, Jon, for being so clear and effective.
My pleasure. It's absolutely my pleasure. Thank you so much.
Thank you. Bye. Have a good day, everyone.